Good morning, everyone. I'm Dr. Priyanka Kapoor, and I'm professor in charge orthodontics at Faculty of Dentistry, Jamia Millia Islamia. At the onset, I would like to thank the organizers for giving me this opportunity to share with you some thoughts on forensic age estimation, an area where we have been working for many years now, and we totally understand its importance being dentists and, yes, forensic odontologists also. So, anything that I'm going to present here will be primarily based on my experience of conducting the forensic age estimation cases, and also the for the teaching purposes, the radiographs, the models, whatever I'm using are of my own patients, and I've taken due consent before they are being used in this presentation. But I would definitely request all of you to not click any screenshots because some cases also would be presented here. So, as general dentists or as forensic odontologists, you many a time come across certain areas or certain news where you get that in 2018 a body was recovered from a rural site in Tamil Nadu, decomposed beyond recognition. These are the kind of lines that you're going to get. And when you look at the photographs, or you look at, or if you have a chance to go and visit at the site, you would look at the body and there'll be no identification marks over there. There'll be no ID, there'll be nothing. So you just right on start from the scratch. So in that is kind of a reconstructive identification. So in a reconstructive identification, you have to estimate the age, sex, and ethnicity of the individual to begin with. But these days the crimes are getting so heinous. All of us know that. None of the perpetrators, they want that the victim should be identified. So they, in any case, they will make all the measures that you're not able to identify the body. So in that case, either it will be a very high pressure area, high temperature area, the body will be burned, there'll be acid. So there'll be many cases where you'll not be able to identify just based on the face or the body structure or even the body type of the individual. So what comes to the rescue then is teeth. Because teeth, as we all know, and you've been discussing for the past 2 days, that the teeth can withstand high amount of pressure, high amount of temperature, and they can give you a fair idea because there's too much of research available. You can base on a scientific research. You can actually tell what is the probable age range of the individual that is right in front of you. So let's walk through how that was done and how you as dental professionals can contribute. So this is one of the cases that we have got. As you know, that nothing is visible on the face and you have to start from the scratch. So how will you start? Basically, you will first start counting what are the teeth present, what is the degree of eruption, what is the developmental stage, what is the radiographic evidence. So you will try and locate the radiographic evidence based on the OPGs or whatever radiographs that are available to you, and you will start seeing what are the teeth eruption stages, what are the teeth that have actually fully erupted. So based on that, some idea you're going to get. So how you're going to get that idea is basically because we are all trained and we are known to take the dental records of the individuals. And then suddenly we have to have a flashback memory and we have to look at the shower and Messler chart and we have to see what kind of the age eruption or the dental eruption status is there based on the individual. So you can have the radiographs, and I luckily am an orthodontist and I've been trained to keep these records for long. And we take some standardized records for photographs and the radiographs and also the casts. So these are the five casts photographs that we take. The radiographs can be the OPGs or the lateral cephalograms that are available with us. And yes, we have the intraoral and the extraoral photographs also available with us. So we maintain these kind of records for many years, per se, primarily for the patient age group. And otherwise, you can also serve as forensic odontologists if somebody comes for matching of the antemortem and the postmortem records. And we've all seen the Hyderabad plane crash and how the forensic odontologists have actually served a great purpose in that. So, yes, we have to have that habit of maintaining those records. We don't know when it is going to come to use. And, on the left side, I've just put some pictures because that is how we are trained. So if we get a picture or we get a radiograph where just the central incisors have erupted, as in the upper left corner, then we'll definitely look at the Schur and Maslach chart, or we'll memorize it and we'll go back to it. And then we will come to know that the individual may be just 6 to 7 years of child. The second picture is of an ugly duckling stage where we can see that the canines, maxillary canines, are erupting. So, yes, the individual can be 12 years of age. In the third picture, in the lower left corner, we can see that the operculum is present, third molar is erupting. So, we can definitely say that the individual may be above 18 to 25 years of age. So these kind of cases we many a time get in government colleges where they come for the age estimation. And this age estimation, luckily or unluckily, the cases have been rising over the years and people are forging their ages like anything. Earlier, genuinely patients did not know their age because they were coming from the rural background. The date of birth was not known, the birth was not registered. So they just had a fair idea, okay, we were born around this time or, in this weather, in this monsoon. So they just had a fair idea. But nowadays, with the birth registry totally in place, definitely the individuals have their matriculation certificate or some kind of identity on them, which can tell the age. But yes, there are many situations where they'll try to hide the age or they'll forge the age. Definitely, forgery is happening in sports quota because the children they want to play in the lower age group. So they kind of try to forge their ages. They can be asylum seekers who are trying to forge their ages so that they can get benefits below 18. There can be many other like civil cases in the retirement benefits and all where they try to lower their age so that they can keep on working for a longer duration of time. So, yes, there are many civil cases, but criminal cases, there is no end to it. These days, lower age group individuals are also conducting such heinous crimes. So, so that they should not be tried as an adult, they try to forge their ages. So, many cases you will get, even, if the child has to be made to work in the factories, then they'll try to upper their age because under 14 in our country, it's not allowed to do hazardous work in factories. So, there's so many areas even for the marriages. So many areas where the age estimation actually bears a lot of importance. And when the such cases they come to the government institutes, then definitely you have a medical board which is comprising of a dentist, radiologist, a general physician. And when you talk about the radiologist, they will look at the bone status of all the body. If you talk about the general physician, they will look at the general body growth, the milestones achieving. So they will look at that. The dentist definitely has to look at the dental developmental stages, how many teeth have erupted, what are the stages of the eruption of those teeth. So yes, that's very, very. And AFCAD is one study group on forensic age diagnostic of German Society of Legal Medicine, which was founded in March 2000. And there I found a very comprehensive age estimation, per se, the directive, where they used to carry the developmental age, the dental age, and the skeletal bone age. Well, we as orthodontists, we are taught to actually study the CBMI staging, which is a cervical vertebral maturation index for the skeletal maturity. And we are sure that all the dentists are actually learning that in their undergraduate era only. And so that is actually for the skeletal maturity determination. Apart from that, you have the hand risk, which is not actually used nowadays quite a bit because you have to take an extra radiograph for it, and it is not allowed for the ethical issues. The other can be clavicle. You can take the CT, but that is also not specifically for the age estimation purposes. So yes, there is a very comprehensive chart, and there was one for the 34 members from 18 countries which were a part of it, and the cases of age estimation have been primarily based on these criteria only. The contents of my lecture would include the definition, the importance, the application, and yes, I would like to just highlight because the time allotted to me is half an hour. I would not exceed that. But yes, the methods of age estimation, I would definitely like to highlight the prenatal, natal, and postnatal, the children and adolescents, the adults, and the interdisciplinary approach. For me, actually, everything clinical has to have a translational aspect. So you need to know that whatever you are doing in your clinic can be easily translated for the forensic on-screen scenarios, provided you have a sound scientific basis for it. So, yes, what is forensic age estimation? It is actually the expertise in forensic medicine which aims to define in the most accurate way the chronological age of a person of an unknown age involved in judicial and legal proceedings. So, please highlight the words judicial and legal proceedings. So, if you're going to the court, you cannot just go on your perception. You have to base your diagnosis or your age estimation on certain scientific basis, and you have to provide proof for it. So we should know what is the right way of going. So why it's important in health sciences is because many of the health sciences people would know that there are many norms which are age based. In fact, recently, not so recent, but yes, in the COVID times, we saw that even the vaccination drive was age based. So yes, many diagnoses of diseases are also based. Endocrinal diseases are based on the ages and the developmental status of the individuals. And if you talk about our treatment perspectives, yes, definitely the functional appliance treatment can only be done at growing age. And the for the trials, clinical trials, you need to have an age and sex matched controls. So yes, age becomes very important. And we have tweaked or we have added a slight amount of category in our case history sheets, where earlier we used to ask the age of an individual. Okay, the child is 13F, which is 13 female. But nowadays, we've added the date of birth also, because that gives you the exact chronological age at the time when you saw the patient. And if you have to do any further research or studies related to it, then you should have the exact date of birth. So please, that is a request to all who are listening to me, that in your case history sheets, please add the date of birth column. And if possible, please take a proof of it, either the Aadhaar or the matriculation certificate, and just put it in your case history sheet. So that will be a very valid proof. And you never know when it can come to use. So yes, we published this article of using mind maps to understand the role of orthodontists in forensic odontology. Please go through it because we've highlighted all the areas where the orthodontist can actually play a role in forensic odontology. But one of the mainstay of that is the age estimation. And if you talk about age estimation, it can be a skeletal age estimation, it can be a dental age estimation. If you talk about the skeletal, as I told you, it can be either CVMI, it can be hand wrist, or the other methods like gonal angles and frontal sinus and clavicle, etc. But if you talk about dental, it can be either you're looking at the teeth or you're looking at the radiograph, you're doing the measurement analysis, that is the odontometric analysis. But you have to know that there are two main ways in which you actually identify or estimate the age. One can be a scoring method and one can be an atlas method. Atlas is just like, an atlas right in front of you. Like for the skeletal maturity, you have a grueling pile atlas of the handrest. And there you have the handrest photographs of many individuals in different age groups. So if you have a handrest in front of you, just match with the handrest in the book or the atlas, and you will come to know the age. That's a very simple thing. It's also applicable in the dental perspective. But if you have a scoring method, where the development of each bone that you are seeing or each tooth that you are seeing is given a definite score based on the age, and it's based on a huge amount of population, then definitely you add on to those scores and you get a total score, which you ultimately translate into the age, which is a scoring method. It's more objective, it's more applicable. And yes, I will tell you some examples of it. And the merchant is also based on a scoring method, because ultimately you have to match the developmental state. Definitely the shape of the developmental stage has to be matched, but there's a score assigned to each developmental stage. So then it becomes more objective and more applicable. Right now, yes, if you have too much of data available with you, you can develop the machine learning algorithms. And there are many researchers who have actually worked on machine learning algorithms for the age estimation purposes also. So, yes, you need to know that this is a gist of the chart, which can tell you that these are the various ways in which age estimation is actually happening and also applicable to the forensic scenarios. If you talk about the dental age, definitely this is known to us that the dental development shows less variability than the other body tissues development, and it has a low variation as seen with the chronological age, and last to be destroyed. So you put it under pressure, put it under temperature, put it in various conditions, in acidic conditions, and it will be the last to destroy. So yes, it is very, very important for the forensic purposes. Based on the stage of development, you have prenatal, natal, and postnatal, you have children, adolescents, adults. In the method, as I said, if you have to compare it with a standardized atlas, then it's an atlas method. But if you're assigning the score and adding on the total score and then giving the age, then it is a scoring method or the regression formulas. Based on how you examine the tooth, you can have a visual method, you can have a histologic method. I'm not a histology person, but I'm really interested. But yes, for that, you need extracted teeth, which is not available many a times in forensic scenarios. In physical and biochemical methods, radiographic and digital methods. So right now, for the research purposes, lots and lots of research is going on the radiographic methods and the digital methods because those kind of data are largely available to dentists and are at their disposal for research purposes. So if you talk about the prenatal, neonatal, and the postnatal, yes, you have the alizarin staining, you have the incremental lines and the neonatal lines, which are the accentuated lines. So they are present after birth. So if that can actually diagnose the stillbirth. So if the parents are claiming that it's a stillbirth and you see these lines, then definitely you can say something is wrong. So that is also applicable for the forensic scenarios. But for the children and adolescents, which is the main area where our research actually can happen, is based on the children and adolescents dental age estimation, which can be visual, radiographic, digital, physical, biochemical, histologic. So you can have various methods which are visual just based on the eruption. Like I said, the Schur and Messler chart. So just based on the eruption, how much teeth is seen to you in the dentition that you can tell. Or you can also tell the radiographic, which is standard atlas and scoring methods. You have digital methods, the measurement methods, and the aspartic acid racemization, which is a part of physical and biochemical, and the cementum annulation. So this chart is, we've been taught to it. It has been taught to us in second year, and it remains at the back of our mind always. So it tells us what is the eruption status at various age groups and what kind of teeth or the erupting teeth that are present in the bone in various age groups. So that is kind of memorized by us, and we do not make a difference or we do not make a distinction if I'm as an observer and if there's a second observer, they would also give the same diagnosis because we are taught, we are trained for it. So let me tell you, this London Atlas actually, Al-Qahtani had given this atlas very recently, and very sadly we lost him last year. But this is a very beautiful atlas, and it is an advancement of, you can say, the Shore and Masla, because the age groups for which they have given the eruption status is lesser in this. So you can get a more age range in this. So you can actually try it. It has also an online version. So if you have to give a comparative research, then you can take two, three methods. And in those two, three methods, if you have to use the Atlas method, then preferably you should use a newer method also and compare it with the conventional methods. So we ourselves had given this chart, which is a dental age estimation chart in 2016, because we had studied the Demergen method and it was quite elaborate at that time. Because if you see the pictures of the developmental stages of the teeth, which are present in this chart, that is given separately in the original article, and then the scoring for each is given separately, and then you have to add, and then ultimately the age you have to translation, those tables are given separately. So it was a huge article. So we thought, why not compile it? Because even the UGs are doing this kind of research. So it has to be something which is very handy. So this kind of an chart, if you kind of just put it in front of you, you can do the age estimation. If you have the panorex in front of you, then I will just tell you in a few slides how you have to do it, and you can easily make a diagnosis, or you can at least use it as one of the methods of age estimation. Now, this is also one of the point that I'm telling you, that whenever you go into the courts or you're going for the scientific thing, you should not always rely on one method. It has to be more than one method, and it has to be more closer to what is applicable to your own population. So yes, we have to do studies which are on larger population data sets, and we have to devise our own scoring methods also so that it is more applicable to our population. So where to assess an emergent is 1 to 7. So left mandibular 17th, the permanent left mandibular 17th are the one which are actually looked into. And if you talk about the FTI notation, the 31 to 38, because they had also given a modification in the original demergent method, you only consider from the central incisor of the left mandible to the second molar, which is a seventh tooth. But in the modification Charlatan demergent, they gave a modified formula where 31 to 38, where the third molar was also considered. So we had prepared charts of both. So this was for the DACC 8, where the third molar also was considered. And if you see, if you look down, there are Indian and the original formulas given in the same chart. So you just have to take this one chart when you go for sitting on that table, where I told you in the first few slides that when they call you for age estimation, there is a panel sitting and you will just be given few minutes to give your diagnosis for the dental age estimation perspective. So this can come very handy for you at that time. So we have this chart which has been actually published and researched in various ethnic populations like Haryana, like Delhi, and many other people are actually using it in the forensic on-scene scenarios. So you're free to use these charts for your forensic applications. And yes, very recent article is a comparison with the London Atlas also, which we've done with this for these charts. So it actually the results have a greater accuracy of Atlas method over the Emergent Comprehensive chart. So yes, in your own population also you can do these kind of comparative studies. Other methods can be NOLA staging. In 1960, it was given. So it gave the staging of development of tooth in between 1 to 10. And for the for in between stages, an appropriate fraction was recommended, like 0.2, 0.5, 0.6. Haviko also was the same. And Williams also is approximately the same to Demergent, but the scoring which is given in Williams is slightly different than Demergent. And many of the researchers, they actually compare the DACC charts of Demergent with the Willems chart and see which scoring is more applicable to their own population. Because ultimately, as I said, if you have to go to the courts, it has to be nearer to your population, and the error rate has to be quite less if you have to take that case to the courts. So Camry also gave very important formulas and has been used world over. And for the Open Apex method, definitely they have identified and they use the ImageJ software, which is a free software. And I myself trained for it, and I'd gone to Turkey, Cappadocia, to have a training with Dr. Camry himself. So it's a very beautiful experience. So as I said, you never rely on one method of age estimation. You should always explore more than one method and see whichever is more applicable. For the developing tooth, even this method is very, very good. And you can try this because it is, as I said, it's on an open free software. And you identify the teeth with the open apices. For single rooted teeth, you have to measure the distance and then you measure the tooth length. And you have to normalize the measurements. And then in the variables, you have to apply the formula. So you will get the age. This is basically a chart that I had prepared how the various age estimation formulas they were devised, the historical perspective, what are the teeth that they study, and how do they actually study it, whether they studied at the scoring method and which tooth they have considered, how they collected the data, on what population it happened, and what are the highlights. So this is all in one chart if you just want to go through it. If the students actually have to appear for their exams, even the UGs have this kind of a chapter. So this is available in our book. You can go through our book, and this chapter of age estimation was by me in this book, and you can actually go through this chart and it will all give you at once in a glance all the age estimation methods. Apart from that, as I said, we should always know what are the newer perspectives going on. So there are many researchers who are actually working on the machine learning and the artificial intelligence in the emergent system. So you have a region-based segmentation or classification. So yes, many researchers are actually going ahead with this. So this is also one area which you can explore if you have a huge data set for a single category of teeth. Yes, for adults, because as we've just talked, it is children and adolescents, but for the adults, it is slightly more difficult because the development of teeth have already completed. So yes, then you should consider the morphologic, the radiographic, the histological, biochemical, and the visual methods. So in the morphologic, you can see, because we all know that the dentinal translucency is going to decrease and it's going to become more opaque with age. The secondary dentine formation is going to be more with age, and there can be 6 morphological parameters which we can consider. For the radiographic, you can have the objective volumetric measurement, or just looking at the development of the teeth, third molar tooth. Histologic, yes, you have the cementum annulation, like you have the neonatal teeth, you have the highlighted or the histologic cementum annulation method also. For the biochemical, you have the aspartic acid racemization and the radiocarbon dating, which is quite useful if you have in the archaeological perspective also. For the visual, you have the attrition. You can look at the attrition. There's just one researcher who's actually worked on the attrition method. So for the age estimation, this is still in adults, this is still the gold standard, although it was given at 1950. But Gustafsson considered six various parameters. The only drawback is that you need to have the extracted tooth for it. Only then this works. You can study the attrition, secondary dentate deposition, apical migration, cemental apposition, root resorption, and root dentine transparency. And scoring has been given for each 0 to 3 for all the criteria. If you add 18 would become the highest score. So yes, it is still the most applicable method, but yes, you need a extracted tooth for it. For the age estimation for the cementum annulation, you talk about the regular apposition of the cementum bands, and as you know, as the age progresses, this is going to increase, like just like the tree barks that we see with the various bands which are available around the tree bark. The same way, the cementum annulations will increase with age. And for the translucency, as you see, if you have to have it objectively, then you have to put it on the software. You have to take the photographs, radiographs, and you have to put it on the software. You have to see how much of dentine translucency has decreased. So there are various formulas which have been given, and also modified Bang and Ram formula in Indian population. So it is quite applicable. You can actually have uh, you can actually do research on it. In the pulp tooth area also, because we see that the pulp area it lessens with age. So that also objectively has been studied with the Cambry's formula. So Cambry has given many formulas for children as well as adults, and you can have a look at that. And any of that which is applicable to your own population, as I said, can be used. So these are the various the methods which Cambry has given. This is Dr. Cambry only. And pulp tooth ratio, open apices method, third molar maturity, carpal and epiphysis, epiphyseal fusion, and fourth cervical vertebra. So many methods he has given. And just based on tooth wear, yes, Lee and G was the only one who has worked on it. They've given the shapes, they've considered that you can actually compare it with the photographs if you've taken of a patient. So this is also one method that you can consider. For the biochemical method, you have racemization of aspartic acid and the radiocarbon dating. Yes, racemization of aspartic acid, the L amino acids, the ratio of that can be considered. And it is a well-researched topic by even Ames Delhi a few years back. So if you want to continue it, yes, it's a very good topic for consideration. But again, you need extracted teeth. And radiocarbon dating, Spalding et al., they gave this kind of a method. And yes, it has been used quite a bit in archaeological perspectives also. For fluorescence of dentine and the cementum, Sigrid Qual and Solheim, recently they were actually lecturing here last year at Sharda also. And based on the intensity of light emitted by a substance, where the wavelength longer than light to which it is exposed. So yes, it is based on the fluorescence and dental color for age estimation. So the postmortem changes also has been considered quite a bit in forensic odontology perspectives. For the artificial intelligence, as I said, many are using the first molar images because, now in adults, this is becoming a greater problem because the people who are committing crimes, they're trying to actually forge their ages. So it's very essential that we have some machine learning algorithm based on single tooth or a set of teeth, which can actually immediately identify and actually calculate the age. Because if we look at the conventional methods, that is quite a lot based on our perception of looking at the teeth. But when it becomes objective and it becomes in the domain of artificial intelligence, then yes, depending on the amount of data sets that we feed into the artificial intelligence machine learning algorithm, it becomes more and more accurate. So the journey, my journey has been first of all to gain knowledge and actually to be trained under Dr. Ashit for forensic odontology, as you see the pictures here. And then we had also gone to the CSFL, which is the Central Science Forensic Laboratory at Chandigarh to get trained. So yes, that interest has to be generated. You have to start something and you have to start the right way. Because if you start the right way, you will get the right results. So yes, we gained the knowledge first And then, as I said, the knowledge never dies. You keep on adding to your knowledge. So I'd gone to Cappadocia for Dr. Cambri's workshop also. And it's really interesting to actually use his methods in our population. The ongoing work, yes, we are working on the Cambri's Open Apex method also for boys and girls, but we are definitely planning to increase the study sample for our population. Then once you gain the knowledge and you do the research, you publish. I've shown you few of our articles which have been published in this domain. You also try to disseminate that knowledge. You don't want to keep it. And also, it's not that your knowledge you're disseminating. It's a kind of a dialogue which is two-way. We get kind of an insights from your side, from the audience side also, and we kind of try to improve it year after year. And that is how we have reached till here. So yes, the students who are listening, please start the right way and follow the right principles. Do the research, be very active in research, and then only try and initiate these dialogues with the faculty or the fellow colleagues. And then our knowledge, it keeps on adding and building up. So yes, we are trying to have this in various domains like left lip and palate. What is the kind of the dental age estimation that is happening in these syndromic patients or the non-syndromic left patients compared to the normal individuals? The ongoing work are also in the cases of craniofacial syndromes, archaeological evidence, and the fossil evidence. With the skeletal age assessment, as we see that a lot of our cases have both the records, the dental records also, and the radiographic records also. So we try and compare and we do the research for the skeletal maturity also compared to the dental age. And for that, now we are using CVMI only. We're not using hand rest. And we have also tried to find out the biological factors which are actually playing a role in skeletal maturity. And we have published a scoping systematic review on it very recently. And you can see that if you want to do studies compared with the biochemical markers, then we have identified these markers like IGF, which is insulin-like growth factor, growth hormone, creatine, and alkaline phosphatase. Alkaline phosphatase is highly indicative. So if you want to do in different CVMI staging, then definitely you can study these biomarkers compared to different CVMI staging. New kid on the block is yes, IIT BHU wins National Award for Forensic Age Estimation Tech. So this was a forensic hackathon which was actually done in 2025 only by NSFU under the Union Ministry of Home Affairs. So they had identified the glycomic profiling coupled with machine learning algorithm to decode the molecular signatures. So see, even our Indian scientists are actually working on it. So this is a huge boost for all of us and it can estimate both the chronological and the biologic age. So please, this is the right time to go ahead with it. Even our government, our ministries are funding the forensic projects. So if you want to go through any projects, it is my earnest request to all the UGs and all the PGs here, under the guidance of your guides, please initiate. These are very small studies which you can begin with, but you never know what can be the result ultimately when you come out with huge data for the age estimation studies. Few scenarios in Mumbai, a teenage boy was accused of a serious offense. He claimed to be 18 but had no documents. So these are the few scenarios which you routinely see where the ages will be they will try to forge these ages. So it can be a Delhi factory. Several children were rescued. Employers claimed they were over 14. Minor girl was rescued from brothel. So again, the traffickers, they said that they claimed that she was over 19, but she was found to be below 16. In tsunami, also in the mass disaster cases, many young victims were identified based on the teeth and daily wage workers, poor record keeping. He was never issued a birth certificate. Now he claims he is 55 and has 5 years, but the department says he's 60 and he has to retire. So these kind of civil scenarios also are available. And cricketers, as I said, I've already discussed this, but yes, this is a huge reality in current times. So, in the end, I would just like to give this message that you have to start early and you have to start with small pilot studies and you have to target your own ethnicity driven studies because they are not available. Use more than one method, don't just rely on one method. Maintain the dental and radiographic record for years to come and always record the chronological age, not just the age of the patient, the exact date of birth. Age estimation must be reported as a range, never a singular age that you have to mention, 6 or 7. It has to be a range. Courts in India have now increasingly recognized the forensic dental evidence in juvenile justice, trafficking, and TPI cases. So, huge boost for all of us forensic odontologists. formulate an interdisciplinary team, ask for help. So this is the mainstay. You should never shy to ask for help. So yes, this is my message to all of you who are sitting here, and I thank once again for a very patient listening.